Hi, Mr. Latch. My name's Amber Logan. I'm an RN here, and I will be getting your information for your health history. Can you tell me what brings you in today?
I need a physical completed for employment.
Okay. And I'm just going to ask you some questions about yourself. Would you describe your health as being good, great, poor, and what type of shape do you believe that you're in?
I believe I'm in great shape and my health is pretty good.
Okay, great. When you were a child, did you have any childhood illnesses such as rheumatic fever, polio, scarlet fever, measles, rubella, mumps, or whooping cough, or chicken pox?
I had the chicken pox when I was 6.
Okay, and how did that go?
Um, it was fine. There were no major problems.
Okay, so you would say it was mild then?
Yes.
Okay, great. Do you have any history of problems with your heart that you know of?
No.
And have you ever been told that you have high or low sugar levels?
No.
Okay, so no history of diabetes?
No.
All right, and have you ever been told you have high blood pressure?
Nope.
Okay. Um, do you have any history of cancer?
No.
Any problems with your lungs?
Nope.
Okay. Any asthma?
No.
Okay. Any mental illness?
No.
Blood diseases?
No.
Problems with your thyroid or liver?
No.
Your kidneys?
Nope.
Any arthritis?
No.
Okay. And you haven't had any seizures?
No.
Okay. Have you ever undergone any surgeries in the past?
I had my sinuses tapped out.
Okay, and do you know when that was?
December 2005.
Okay, and you were under anesthesia for that?
Yes.
And were there any complications?
Nope.
So you woke up fairly easily then?
Yes.
Okay, great. Have you ever been in any accidents or had any major injuries?
Nope.
Okay, and do you have any allergies to any drugs, food, or pollen?
No.
Okay. Do you currently smoke?
No.
Do you use any tobacco products?
No.
And have you ever smoked or used any tobacco products in your life?
No.
Okay, great. Do you ever drink any alcohol?
Um, Occasionally, but not very often.
Okay, and how many times a month would you say?
Um, Maybe, I don't know, 3 times a month at social gatherings.
Okay, and about how much would you drink at each social gathering?
2 to 3 drinks.
Okay. Are you currently on any medications?
I take 250 milligrams of Topamax twice a day
And what is that for?
for migraines.
Okay. Any other medications?
And I take naproxen for pain for my migraines as well.
And what milligrams do you take for that?
400 milligrams.
Okay, so that's as needed for pain for your migraines?
Yes.
Okay. And have you had all your immunizations that you know of?
Yep.
Okay. Do you currently see a doctor on a regular basis?
Yes, I see Dr. Mark Liebright at the Fairless Hills Medical Center.
Okay. Um, and can you tell me a little bit about your lifestyle, your living situation, your educational background, and your finances, if they are adequate?
I currently live in Yardley, Pennsylvania with my parents. I have a bachelor's degree in education and special education from Temple University, and I'm currently looking for a job.
Okay. And this physical today, will you be submitting that to potential employers in school districts?
Yes,
Okay. Um, and do you live with anyone other than your parents?
just my brother.
Okay. And how would you say that your finances are? Are they adequate?
Um, no, right now I'm currently living off of my savings.
Okay. How many hours would you say you sleep each night?
7 to 8 hours.
Okay, and do you have any insomnia or awakenings during
No,
the night?
no,
Do you take daytime naps?
nope.
Okay. Um, if you can think back through the past 24 hours, can you recall what you've had to eat and drink? Just so I can have an idea of a daily diet for you on average.
I had a bottle of vitamin water, a cup of coffee, a pumpkin muffin, um, a bacon and blue cheeseburger, with French fries, a Coke, a pack of fruit and nut, or no, sorry, nut and berry trail mix, and 2 handfuls of mixed nuts.
Okay, are you on any special diets?
No.
Okay, and you stated that you are in good shape. What do you do to exercise?
I run 3 to 5 miles once or twice a week.
Okay, great. And are you satisfied with your sex life?
Yes.
And how many partners have you had in the past?
One.
Okay, and how long have you been with your partner?
12 years.
Okay. Do you have any religion or spiritual beliefs?
No.
No? Okay, so you don't have any religious diets that you follow?
No.
Okay. I'm going to ask you some questions about your family members and just answer the questions to the best of your ability that you do know of, just to help me get an idea. Your mother's mother, how would you explain her health if you do know?
She's in good health, but she has a history of anxiety and high blood pressure.
Okay. And your mother's father,
I really don't know that much about her medical history at all.
his medical history, your mother's father?
Oh, sorry. No, I don't know anything about his medical history at all. She was adopted.
Okay. And your father's father?
I don't know any much about his medical history.
Okay, and your father's mother?
Um, I know she suffered depression, um, but that's about all I really know about her medical history.
Okay, and she's no longer living?
No.
Okay. And your father, do you know his medical history? And if so, how old is he?
My father is 58. Um, he has high blood pressure and high cholesterol. Um, that's it.
Okay, and he takes medication?
Yes.
Okay. And your mother?
She's 52. She has high cholesterol, and that's it.
Okay, and is she taking medication?
Yes.
Okay. And you said you had a sibling?
Mm-hmm.
Oh,
He's 27. He has high cholesterol, and he was just placed on medication for that.
oh, okay. And that's all? No
Yep.
other issues? Okay. All right. I'm just going to go through in depth with you to get more details about your health in different systems. So I'm going to pretty much do a head to toe assessment and just ask you some questions about your body in different areas. Overall, how much would you say that you usually weigh? Today you weigh 150. How much do you usually weigh that you know of?
About 150 pounds.
Okay, so you haven't had any weight loss recently
No.
or weight gain. Okay, great. Do you ever have any fever, weaknesses, or night sweats?
No.
Okay. And your skin, do you have any rashes, bruising, or dryness?
No.
Discoloration or lumps?
No.
And any changes in the growth of the hair in the body?
No.
Your nails?
No.
Yellowing of the skin?
Nope.
Okay. Have you ever had any head trauma?
No.
Okay. Do you ever have, you said that you take Topamax for migraines?
Mm-hmm.
Okay. On a scale of 1 to 10, what would you say that your pain ranges from when you have your migraines?
About a 3 to a 9.
Okay. Do these migraines prevent you from doing any activities such as dressing yourself, eating, or going to work?
No, I
No.
just kind of do what I have to do.
Okay, so you can work through them.
Yes.
Okay. All right, so you're currently taking Topamax twice a day, prescribed by your doctor, or do you see a specialist?
Let's see a neurologist.
A neurologist. Okay. And since you've seen a neurologist, have your migraines gotten any better?
Yes.
Okay. So you would say they've decreased.
Mm-hmm.
Okay, great. On average, how many migraines do you experience currently per month, would you say?
About 3.
Okay. And how many did you used to have? Would
Maybe 10.
Oh, okay. All right. Okay, let's move on to your eyes. Do you have any blurred vision or double vision?
No.
Okay, and do you know when your last eye exam was?
2010, I think.
Okay, and do you remember how your eyes were at that time?
2020.
Okay, great. So you don't need glasses then?
No.
All right. Do you ever have any pain or redness, tearing, glaucoma,
No.
cataracts?
No.
No? Okay, any history of infections such as pink eye?
No.
No? Okay. Do you ever have any issues seeing at night or when driving?
No.
Experience dry eyes or light sensitivity?
No.
And do you get light sensitivity with your migraines?
No.
Okay. Moving on to your ears, do you have any problems hearing?
No.
Do you ever have any inner ear pain or discharge?
No.
Any ringing in your ears?
No.
Okay. And do you ever have dizziness?
No.
Okay. All right, we'll move on to your nose. Do you ever experience frequent upper respiratory infections?
No.
Have you ever had anything stuck in your nose?
Nope.
Any objects?
No.
Okay. History of bloody noses?
No.
Okay. Any problems smelling?
No.
And any sinus troubles? You mentioned that you had your sinuses tapped out. How are they now?
They're better now.
Okay. Do you ever use anything to help clear them?
Occasionally I'll use a saline spray just to loosen stuff up, I guess.
Okay, just for comfort.
Yes.
Okay. All right, and let's move on to your mouth and your throat. How would you say that the condition of your teeth and gums are currently?
Good?
Good? Okay. Ever experience any bleeding from the gums?
No.
Okay. Any problems with your taste buds that you know of? Any altered taste?
No.
Okay. Do you ever have frequent throat infections or sore throats?
No.
Any ulcers in the mouth?
Nope.
And any need for dentures?
No.
Okay, so you have all your teeth?
Yes.
Okay, and any of them broken at all?
No.
Okay. Do you know when your last dental exam was?
May of 2012.
Oh, okay, great. Let's move on to your neck. Do you have any lumps or swollen glands?
No.
Do you ever feel any pain or stiffness?
Nope.
And do you ever feel any fullness in the middle of your neck?
No.
Pressure or anything? No? Okay. Your breast, do you have any lumps or nipple discharge?
No.
Do you have any ulcers on your skin?
No.
Any pain or skin changes?
No.
Any dimpling of the skin?
No.
Okay, great. Under your armpits, do you have any lumps or soreness?
No.
Okay, and do you ever examine underneath, like your breasts for tenderness?
Occasionally.
Okay, like how many times a month? Maybe once a month?
Yeah.
Okay, great. All right, let's move on to your lungs. Do you have any coughing or problems with mucus?
No.
Any wheezing?
No.
Okay. So, any history of asthma, bronchitis, or emphysema,
No.
tuberculosis, or inflammation of your lungs at all?
No.
Okay, great. Let's see. So you said you did not have any high blood pressure or heart problems. Do you ever have any fainting spells?
No.
Any chest pain?
No.
Okay, any trouble breathing?
No.
Any palpitations?
No.
History of rheumatic fever or heart murmurs?
No.
Okay. And have you had an EKG in the past?
I had one 2 years ago.
Okay. Do you know the results of it?
They were normal.
Okay, your doctor said it was normal. Okay.
Yeah.
That's great. Let's move on to your stomach then. How would you describe your appetite?
Normal. Good.
Good? Okay. And do you have any trouble swallowing?
No.
Any heartburn, indigestion, nausea, or vomiting?
No.
Okay. Any regurgitation at all? No?
No.
Okay. When you use the bathroom and you have a bowel movement, how would you describe your bowel movements? Are they formed or loose, in the liquid form, or are they solid?
Solid.
Solid?
Normal.
Okay. And when you say normal, what color would you say was normal?
Brown.
Okay, great. And when you use the bathroom, do you use the bathroom every day, every other day?
Every day to every other day.
Okay. So it varies then?
Yes.
Okay. And do you ever find that you have any blood in your stool, or like red blood or black tarry substance?
No.
No? Okay. And any periods of diarrhea or constipation?
No.
Okay. Do you ever see any mucus in your stool?
No.
Do you have any hemorrhoids?
No.
Do you find that your stomach has a bad reaction to any foods in particular? Any intolerance with food?
No.
Okay. Do you have any excess burping or passing gas?
No.
And any problems in the past with your gallbladder or liver?
No.
Okay. And do you have a history of hepatitis?
No.
Okay. All right, let's move on to urinating. Do you have any problems urinating?
No.
Do you find that you urinate in the middle of the night at all?
No.
Okay, so you don't have any the urge to go often or any frequency?
No. Normal.
Okay, and you've never had any blood in your urine?
No.
Okay. Do you have any history of kidney stones or urinary tract infections?
No.
Okay, and do you ever notice any force that you need to urinate?
No.
No? Okay, great. Okay, we're going to move on to your reproductive system. Um, what would you say that your sexual status is?
Heterosexual. Straight.
Okay. Have you ever had any hernias or penile sores?
No.
Sores on your penis?
No.
Okay. Any discharge from your penis at all?
No.
Any bumps or pain on your testicles?
No.
Any history of sexually transmitted diseases?
No.
Have you noticed any change in libido,
Mm,
functioning,
no.
or potency? No? Okay. All right, we're going to move on to your arms and legs and how your blood flows through your veins. Um, have you ever had any problems with inflammation of your veins?
No.
Okay. Do you ever have any swelling or discoloration, like different colors of your extremities of your arms and legs?
No.
Okay. And do you have any varicose veins?
No.
All right. Um, any clotting issues that you've ever had in the past of your blood?
No.
Okay. All right. Let's move on to your muscles and joints. Do you experience any joint pain, stiffness, arthritis, or swelling?
No.
Okay. Do you have any backache or deformities?
No.
And have you ever experienced pain in your thumbs or in your big toe?
No.
No? Okay, that's known as gout. All right. So you do not have any history of weakness, seizures, or dizziness, you had said?
No.
Any previous bouts of paralysis, numbness, or tingling?
Nope.
Do you ever get any tremors or involuntary movements?
No.
Okay, and have you ever had any trouble balancing when you're walking?
No.
Okay. Have you ever had any excess bleeding or bruising that you've noticed?
No.
And have you ever been told that you're anemic?
No.
Okay, and you have had lab work in the past?
Yes.
Okay, and have you ever had any blood transfusions?
No.
Okay. Do you have any issues with your thyroid? Um, any heat or cold intolerance? Feeling hot or cold compared to others?
No.
Okay. Any recent weight gain or loss?
No.
Feelings of nervousness or pressure in your throat?
No.
Okay. Any change in your voice or um, fatigue, feeling tired?
No.
Okay. And your hair, is it full? Is it thinning? Is it falling out anywhere?
Nope.
Okay. And do you ever experience excessive thirst, feeling that you constantly need a drink or that you need something to eat?
No.
No?
Normal.
Okay. And any trouble swallowing at all?
No.
Okay. Um, do you have any nervousness, anxiety, memory defects, or mood swings?
No.
All right. Have you ever had any hallucinations, sleep disturbances, delusions?
No.
Okay. And have you ever had periods of um, feeling that you couldn't catch your breath, like hyperventilating?
No.
Okay. And do you suffer from any forms of depression?
Um, my doctor said I might have seasonal depression,
Okay.
but it's not really officially diagnosed.
Okay. Are you undergoing any sort of treatment for it or?
Um, my doctor said to go to a tanning salon to sit under a UV light to help reduce the severity of it.
Okay. And do you find that it improves the episodes?
Um, Occasionally.
Okay, great. Okay, so in the past you have had a history of migraines. Um, you believe you may possibly be suffering from seasonal depression, and you're encouraged to go to the tanning salon for UV light therapy. You have had your sinuses tapped out with no complications in 2005. Your family seems to have a history of high cholesterol. And with your lab work, have you ever gotten cholesterol levels drawn, or are you planning to do so?
Yes.
You plan to do so?
Yes.
Okay, great. All right, that concludes our interview. Do you have any questions for me or anything you'd like to talk about?
No.
No? Okay. All right, well, we'll just get your health assessment going here so I can complete your paperwork. Thank you for coming in.
Okay, thank you.